Okay, so as Grace mentioned, I'm here to talk to you about telehealth, particularly around attitudes pre and post COVID-19. But I will start by telling you a story. So this is my little girl called Cleo. Like all new mums, I love spamming my family with cute photos. But also, like new mums, I'm often at my GP asking lots of questions. So, is it an ear infection, or is she just teething? Is it, is it just a heat rash, or is it meningococcal? Do I need to go to ED? So I'm lucky enough to come from a family of health professionals. So my dad's an orthopedic surgeon, my brother's a plastic surgeon, and my other brother is a pharmacist and owns pharmacies. And usually I send cute photos like this, but one day, one evening, I was instead sending photos like this, and the message read, "Look, is this serious? I'm travelling tomorrow for work, and Henry's away, so I need to know now what to do." And they asked me a number of clinical questions, and then everyone determined that she had impetigo and required antibiotic ointment. But the problem was, it was 9 o'clock at night, so my regular GP was closed. So not only would I have to find a late night GP to access the prescription, I'd then need to find a late night pharmacy. And I think in the context of pre-COVID-19, it's this sort of accessibility and convenience that telehealth really provided patients. It wasn't just about convenience because I can't be bothered to go get my pill, but it was also people like me, you're desperate, you've got a UTI, you've got a, migraine, there's a lot of pain relief, and you really just need quick access to healthcare, which can be quite challenging obtaining in a brick and mortar practice. So accessibility and convenience were really the areas of focus for telehealth pre-COVID-19. So just quickly, I run a platform called Medinet. So you can speak with the GP 24/7 anywhere in Australia. You can choose to speak with the first available doctor or choose from a number of doctors online. You can filter by special interest, languages spoken, or gender. The conversation starts as a chat functionality, so just like I was doing with my family, where you can upload photos. But if either party prefers, they can change to do a face-to-face video consultation. Via the app, patients can access prescriptions, and then they can choose to pick it up from their local pharmacy or have it delivered. They can access specialist referrals along with upfront information on surgeons, fees, waitlist, location options and experience. So that was my company, Patient Connector, that now is a product within Medinet. They can access medical certificates, and you can directly email it to your employer or university within the app. And also access pathology results and Rijt this second, thanks to COVID-19 referrals as well. So the aim was, it was about providing accessibility and convenience to all of the reasons you'd see a GP in a brick and mortar, but obviously it was up to the GP to determine, the clinical appropriateness. It's not obviously always suitable to use telehealth. So we were averaging late last year 17 consults per day, or around 500 a month. We're pretty happy with these numbers considering we're only 7 months in market. Had 18% active users month-on-month growth and 48% increase month-on-month in consults. We had a number of good strategic partnerships for the company as well. There was definitely a strong interest in telehealth. Evidenced by the increase in MBS rebates available for telehealth, but they were always very specific. Sometimes people said, the criteria was so narrow that not really anyone could use it. There was also a new federal government rebate for incentivising medical practices to stay open in after hours. So the me equivalent didn't end up in the emergency department. And as part of that rebate, it was black letter that the after hours care could be provided via telehealth. And of course, the RACGP, the Medical Board of Australia, they have guidelines for GPs and healthcare providers around how to, provide clinically appropriate care via telehealth. So there was certainly a strong interest in the space, and it was growing. But there's no doubt that there were also reservations. One of the interesting pieces I heard through the pipeline was telehealth actually provides too much accessibility to healthcare. There's almost a a natural triage process where it's the inconvenience of getting in to see your GP or the inconvenience of going to the ED that creates a self-triage process of patients. So there was a fear that, you know, too much convenience and too much accessibility would flood the healthcare system. Certainly for people, it was, you know, for some it's too progressive, so we sort of jumped on a lot of early adopter doctors, but even for some health insurers, the thought of indemnity insurance for telehealth was a little bit too far for them. And of course there was the question around, you know, can you really provide good clinical care without physically seeing a patient? And I always have that conversation with the doctors using our platform. I think that their message is very much, there's no way that the telehealth, there will never be a need for physical examinations and brick and mortar practices. I don't think any telehealth provider is aiming for that to occur. It's either a nice way to supplement face-to-face, or indeed there are a lot of clinical cases where you can provide 100% of that case online and in an appropriate clinical way. Then this thing that we've all heard of called COVID. What was interesting for me is it was really from not the patients when I realised the change in attitudes, but it was actually from the GPs firstly. So I have a colleague whose job is essentially in sales to medical practices and doctors. And there were a number of conversations he'd had and I'd had with doctors where worried about those things I'd already talked about, so a bit more of a conservative mindset to telehealth. And suddenly they were approaching us, asking really specific questions such as, how long would it take you to onboard, 40 doctors? The problem that I found that they were really facing is if you put the doctor's business hat on, if they have a positive case in their practice, then they have to shut down their practice for 14 days. And as any business owner, that means a lot to the business. And of course, if you then put their doctor hat on, having lots of people turn up to the practice with, at risk, putting other patients at risk. So there was a lot of fear, and of course staff at risk. There was a lot of, I don't like the word, but it was fear or risk mitigation around making sure that they're not actually spreading the virus. So then of course, the patients actually came after the doctors. So on the back of that, we realised that doctors are really provided with the same clinical guidelines to screen patients for coronavirus. And so we implemented a coronavirus assessment. So patients can now use our service, say they've got, it's for screening for coronavirus, and they're asked the specific Australian guidelines questions. That's presented as a health summary for the doctor at the start of the consultation. So then they can really focus in on what are the really important, more detailed clinical questions to really provide the right clinical pathway for that patient. So it's been a really interesting few weeks where, a number of companies have had to pivot to really, realising that they're in a situation where they've got the technology and the people and can really leverage what they've already got to help, curb the spread of the virus and be really useful. People always talk about the importance of having a customer pulse, good communication. I'm lucky enough to be in a WhatsApp group with the doctors that use our platform. I say lucky enough, I'm being a little bit tongue-in-cheek because the problem of providing 24/7 care is the WhatsApp is 24/7 as well. But one Sunday night, a few Sundays ago, one of the doctors asked, can we generate a pathology referral within the app? Because they can immediately generate prescriptions, specialist referrals, medical certificates. And I went to autopilot and said, product roadmap, it's 5 weeks away. And then I realised that with COVID-19, with this influx of patients needing, to speak with a GP, if the patient's deeming it clinically appropriate, the main course of action that they need to take is to generate a pathology referral in order for the patient to have a swab. So instead of writing, no, that's 5 weeks away, I said, of course, yes, you can generate a pathology referral. And then I spent the night with the team trying to work out how to actually make that happen. So it was a lovely, seamless experience for the doctor with no administrative burden. That translates to a huge administrative burden for the team at Medinet. But finally, the tech has managed to catch up with that business decision, because that's a problem with tech companies. You make a business decision and there's a tech ramification. It doesn't happen, 4 hours later. So our doctors can now generate pathology referrals via Medinet as well. It's been a really interesting well, I'd say a month or a few weeks, I don't even know anymore, but when we went from 17 consults a day to 200 consults a day, we're screening a lot of patients for COVID-19, of course, but our patient base is quite diverse still, because there's those people who need their antibiotics, need their blood pressure medication, need their, eczema cream, and they're trying to, whether it be to protect themselves or have an idea of protecting the community, don't want to go into a medical practice. So are looking for other pathways online to access their GP. And certainly our doctors have diversified. We've got, talked to David about the onboarding process. There's some pretty people who are not used to using technology to provide healthcare, but it's been really interesting. So obviously we've got to focus on making sure that it is a really good experience. So when COVID-19 passes, hopefully we're still providing good clinical care and experience to both patients and doctors, and then that hopefully means that telehealth will be more mainstream. There's no doubt that we've taken it to a certain place, but there's a lot more that can happen when technology is supporting COVID-19. So we've been in a lot of discussions around, how can we do pathology collection at the home, or, how to enable even at-home test kits. Look, there's a lot of things in healthcare that you can't cut corners, of course, because you always have to be safe. But, when we're telling people they need to remain in isolation, there's a lot more that technology can do to assist that. I'll just start with saying that one thing that I have realised through COVID-19, a lot of friends and a lot of colleagues working in technology and healthcare, is if there's any silver lining in this, a lot of companies who have been nervous in engaging with technology, they've now turned to us to sort of see how can they expedite the process and really leverage that technology that exists. So I'm hoping the silver lining moving forward post-COVID-19 is that there will be a lot more attitude from, an innovative attitude from companies and government to leverage the great technology that we have. Thank you.
Thank you, Tess. And the questions are pouring in, so we're going to jump straight in because of timing.
Okay.
And thank you very much.
No worries. I don't know where to look. That was
I'm there on that camera and I'm here, and that's fine. A lot of them are coming around the business model.
Sure.
Because we were talking about that earlier in the day around who pays and stuff. So, and then also, so let me just ask a multi-question.
Sure, okay.
People's questions at once. So, assuming patients pay something out of pocket, so how do you get the price point? Mm-hmm. Which feeds into you talking about having the customer pulse. Who do you consider the customer to be? Mm-hmm. Is it the pulse of the patient groups or the pulse of the doctors? Mm-hmm. And the last bit is because there's not enough MBS funding. I can circle back to these.
I was going to say, I'm going to write these down.
So I'm going to say,
that's all right, I'm good.
Price point, who's the real customer? And then with lack of MBS funding for telehealth in a widespread manner.
Sure.
How much time do you spend selling your product to your customers, which we're about to define, versus like lobbying and trying to change policy around MBS?
So, okay. So you're right. When I use the customer pulse language, I was referring to doctors, so GPs specifically. It's a marketplace, so you have to have liquidity between supply and demand. So there's always, I had a conversation yesterday with the doctor where they want to change some of the design of something. And I said, patients will hate it. And it's this really big tension between, not tension always, but you have to consider both parties. So look, my customer in the, well, I'll tell you our actual customers in terms of who pays. So pre-COVID-19, our we have a number of customers. So the first is patients who pay a private fee to access doctors online, and I can talk about determining price points later. Secondly, now there's an MBS that the federal government is paying, but to be clear, they're paying the doctors directly, so that money isn't flowing via Medinet. The third is private health insurers. So we have some private health insurers on board who are, the biggest problem we're solving for them is for international students. So they, a lot of international students don't have primary health care in their countries back home. So they get a cold and they're heading to the emergency department, and the private health insurer has to pay for that. So that's the problem we're helping to solve for them, is providing, you know, better access to primary care for overseas students. We provide a service fee and referral fee for pharmacists and specialist doctors as well. So we're a lead generator for their businesses, and they leverage our technology to try and build their practice. So they're the different customers. When it comes to MBS funding, to be honest, I've always had an attitude. I come from a background in policy, so I've always had an attitude of, you know, interest in policy, and not so much lobbying in the traditional sense, but certainly having a pulse on what the policy is. To be frank, my attitude has always been that the government there will never be an MBS item number to be able to access, you know, a GP less than 20 minutes, above 20 minutes, the same as a face-to-face, because I genuinely believe that they wouldn't be able to afford it. So our business model was always on the premise, never rely on an MBS item number coming through. So that's where you've got to provide for me, it's how do you create value that's even better than going in to see your GP? So that's where it's the bells and whistles around, you know, being able to have your medication delivered, and providing all that transparency around surgeons, so you can provide, you know, make a right choice around fees, wait lists, and locations, for example.
Yeah.
Have I missed anything?
That's perfect, and actually feeds into our last question, which is someone to know if you had a chronic disease, a disorder, and you wanted to tap into the same GP, that idea of continuity of care.
Yes.
That you can be delivered over telehealth.
I think that continuity of care is the biggest negative that is really important, that telehealth needs to make sure it doesn't contribute to. So there's a few things that we do. So as part of it is we're not onboarding doctors, but we onboard medical practices. And as part of that, they then advertise Medinet as a way to access the doctors. So that then means if you're a patient of that practice, you know that they're accessible on Medinet. So we have a number of doctors who say, you know, they used to be told, oh, I'm worried if I have a question overnight, can you give me your mobile number and I'll call you? And for privacy,
like,
they
no,
wouldn't.
thank you.
So now they'll say, I'll be online on Medinet and you can contact me there. We also have the tech is built so that when you say this is my regular practice, the GPs from your practice are listed at the top. So we're trying to, whenever possible, link in with the regular GP. Finally, if the regular GP is not available, we provide a clinical summary back to the regular GP, so they're abreast of any consultations that's occurred.
Yeah, I mean, this sounds like it's a well thought out business, because telehealth, unfortunately, is littered with startups that didn't make it. And so it is a complex thing. I think your point about not relying on an MBS number in your business plan is probably what's keeping you going. But these new times of everyone wanting access to care, it's just going to be changing. So that silver lining element, I think it's here. I think it's the age of telehealth, personally. So in the interest of time, I've got to...
No worries.
Thank you so much for coming in. Thank you for your time. Thank you for your questions, everybody.